And this is our parallel session on building sustainable partnerships for health decision-making and One Health collaborations. As I said, we can just go to the next slide. I just wanted to, for the participants here, give a brief, in a nutshell, overview of our GEO Health community of practice. The GEO Health community of practice's mission is to improve health decision-making using environmental observations. And we serve as a global network of governments, organizations, and observers who seek to use Earth observation data to improve health decision-making at the international, regional, country, and district levels. We conduct our activities through bi-weekly teleconferences, as well as symposiums and presentations at a variety of meetings throughout the year. Typically, our most important meeting, and still a very important meeting, but prior to COVID, it was our in-person meeting, was held in partnership with the American Geophysical Union's fall meeting in the United States. We're still, of course, in partnership with the AGU, but those meetings have been virtual in December 2020, and hopefully we'll be back in person this coming December for our in-person meeting to see everybody again. We, of course, presented the GEO Symposium, as well as a Merit GEO Week, showcasing the projects of the Americas, which that is coming up in August. Just to say, with the GEO Health community practice, we really serve as an umbrella for all of the GEO activities that have some type of intersection with health. Of course, the Earth Observations for Health initiative of GEO is one of the most important, but we bring in all the other groups of GEO that have some type of health facet to their work. So we're very ecumenical, and again, it is open to everybody. So if we go to the next slide, we are inviting you all to join the GEO Health community of practice. Again, we have bi-weekly telecons, not only focused on the global pandemic, many of them are, but our bi-weekly telecons also focus on many other critical issues to the health and air quality communities. Our next one is coming up on June 29th. They're always at 8:30 a.m. Eastern Daylight Time, which is GMT -4. Let's go to the next slide. Of course, as I mentioned, a big priority topic of the past year and a half is the global pandemic with COVID-19, but our health community practice is also self-organized into work groups looking at many different critical issues to the community, including heat-related health risk, environmentally sensitive infectious diseases, air quality, wildfires and respiratory health, food security and safety, and healthcare and infrastructure. These small work groups are looking at these issues to not only identify opportunities in these types of issues of where that the GEO Health community of practice can work together to help tackle short-term and long-term critical needs, but also identify gaps in the knowledge in these topics as well. Let's go to the next slide. We have a esteemed panel here today to speak with you on many of these issues, so we're certainly looking forward to that. And the last slide is our contact information. Again, feel free to contact me or my co-chair, Julie Turton, as well as our executive coordinator, Helena Chapman. And please visit our GEO Health website, geohealthcop.org, for more information on community of practice and the Earth Observations for Health initiative. And with that, I'm going to now turn it over to our executive coordinator, Helena Chapman, who will be introducing our first panelist as well as the subsequent panelists. So take it away, Helena.
Great. Well, thank you, John, for that exciting introduction to jumpstart the GEO Virtual Symposium. And it's an honor to be able to present our first panelist. Dr. Ben Zajac is professor at Johns Hopkins University, located in Baltimore, Maryland, in the United States. He's an earth scientist who studies hydroclimatic variability across a range of spatial and temporal scales, including work on fundamental atmospheric and hydrological processes, as well as the application to problems of water resources, agriculture, and human health. And I've asked all of our panelists to provide a little quote, and his quote: "The COVID-19 crisis has shown a light on multiple links between human health and the environment. It has also shown how important it is that we work across fields to understand these connections and that we communicate our findings effectively." So Ben, the floor is yours.
Great, thank you so much, Helena. And thank you, of course, to the whole EO4 Health leadership for the opportunity to participate today. So my charge has been to talk about seasonality relevant to the COVID-19 pandemic. And this is a complex issue, and I'm going to talk a fair bit about what we don't know. So before I do that, I do want to stop for a moment and say, since I'm the only speaker focused on kind of this element of COVID-19 in today's session, I want to say that we, first of all, should say kudos to the Earth observation community on the way that broadly the community has stepped up during COVID-19. So again, seasonality is the problem I'm going to talk about. It's got its own challenges, but here's just an example of a NASA image that probably everyone has seen many times by now, showing the change in pollutants occurring when lockdown first occurred in China last year. And Earth observations were all over this from the very beginning. And I had nothing to do with this image. It's just a broad community effort, and we've learned so much. I mean, I think we're only learning now how much we've learned during this pandemic, thanks to Earth observation. So I want to get that out of the way before jumping into some of the issues that we don't quite have answers to yet. And so next point is just let's remind ourselves where we are right now. So Johns Hopkins coronavirus dashboard showing cases and deaths and just really the scale of tragedy that we've observed in the past year and a half associated with COVID-19. And also noting that the temporality of this has been confusing to say the least. This is the global picture. Now it's a big composite of all the issues that go into the timing, be those different climate zones, different countries, different testing rates, different now variants and vaccination rates. So there's a tremendous amount of explanatory variables involved in this figure. And the picture gets a little clearer if you go down to the country level, but still quite confusing. So those of us in the United States certainly remember that when the epidemic first hit in the spring of 2020, there was some expectation in some circles that we would see it peter out in the summer, right? And that is due to our prior expectation, which I'll talk about in a moment, about what we expect to happen with respiratory viruses. However, then we saw a secondary peak that at the time seemed like a big peak in the summer, right in the height of summer of 2020 for the Northern Hemisphere. And at that point, a lot of people said, see, this is clearly not seasonal, right? We're having a peak in the middle of summer. And then yet we saw another peak in the winter, the biggest peak that we've experienced, at least so far in the United States, hopefully the biggest peak we will experience. And that came in the fall and winter of 2020, 2021, and maybe did demonstrate, which again, intuitively to us looks like seasonality. There's some challenges with this. So then you go to our colleagues in South Africa who last, in the period of, May, June, July of 2020, when the Northern Hemisphere was so focused on summer and the hope that perhaps it would suppress the virus, they were of course heading into winter, and their concerns were paralleled by the true risk that we saw as a big outbreak happened in those months in the Southern Hemisphere. So again, one could say, well, was this consistent with seasonality? Well, the problem is it's happening in parallel to outbreaks in the United States, in the Northern Hemisphere. And then we see this interesting peak in the winter of 2021 in South Africa, which might have had some variant influence, but also might have had to do with holiday seasons, which is a different kind of seasonality, not related to meteorology. And you can continue to look through countries. For example, when you see something like what we've observed in France, where you might have seen this Northern Hemisphere increase in the fall of 2020, but then it shut down. Of course, what we're seeing there is very effective non-pharmaceutical interventions. And then a later peak coming that we observed in the spring. So you see something that will not be evident as a cold season peak because of all the competing factors. And on to India, if you consider, the most heavily affected subtropical or tropical country to date in terms of total numbers. Of course, we saw a rapid and catastrophic increase in both cases and deaths in the Northern Hemisphere spring, May, June, I should say March, April, May of 2021. And this happened at a time, of course, when India was getting to its warmest period. And at the time, I was fielding emails from some colleagues in India who don't work specifically on this issue, but were wondering, does the heat make COVID-19 worse? Because that's what's happening right now. So we had a situation of correlation there that was different from the correlation we might have seen in other places. And then just finally, if you look at a Northern Hemisphere case like Russia, where you had, again, something that might have looked like a wintertime peak, but then it stayed high and has resurged recently. And again, this is so complicated by variants and other issues at this point. All of that simply to say, the first point that I should probably make, in the biggest font that will fit on a screen, is that COVID-19 outbreaks can happen at any time of year in any climate zone. And honestly, this has been the message that really has been of utmost importance for the Earth observation community and epidemiological community to convey over the first year and a half of the pandemic, which is that whether there's seasonality or not is an interesting question that we'll discuss more in a moment, but the fact is that this can happen at any time. Okay, so just because you're heading into summer, even if you think there's a seasonality that might be protective, you can't relax your policies because this virus has proved perfectly capable of killing anywhere in the world at any time of year. And yet, right? And yet, so why are we talking about this? Well, there is considerable prior reason to expect that something like COVID-19 or SARS-CoV-2, the virus that causes it, should be seasonal. And why do we expect that? Well, because of influenza, because of the common cold, because of other upper respiratory viral infections that have shown some pretty clear seasonality. So we went into this pandemic with that prior, right? That's people weren't making it up when they said back in the spring of 2020 that they thought it would go away in the summer, right? There's a reason why people thought that. In addition, we do at this point now have laboratory evidence of environmental sensitivities of SARS-CoV-2 that are consistent in general with these prior expectations. The virus tends to have better viability, better stability at colder temperatures, some indication also at lower absolute humidity, so those experiments are a little tougher. Ultraviolet light does kill the virus in the lab. It's a pretty clear thing that ultraviolet light does to viruses, all right? So there's evidence there as well. And now at this point, I would say in the last few months, we've seen some epidemiological studies that claim to have isolated a seasonal meaningful pattern. And I say this, there have been studies who have claimed that from the very beginning. I would say that the first round of studies were well-meaning efforts to get results out quickly in the face of a global crisis, but weren't necessarily robust in their conclusions on seasonality. I would say some of the more recent studies are moving in that direction thanks to the longer time record and ability to implement some more sophisticated methods. So why does this matter? I just said COVID can kill anytime, any place, and yet we might think there's some seasonality there. And so one might say, well, stop talking about it. Really, this is not the issue right now. This is about, the fact that the virus can kill anybody and that we need vaccinations, and certainly that is a priority. And yet it still does matter a lot. So if you're standing in the United States right now, like I am, you're feeling pretty good about the current trajectory of the disease. Okay, the case numbers are going down, and that's of course thanks to rapid vaccination campaigns. And that's happening in a number of countries that have had access to the vaccine at an early date. And yet it's still not clear how much the decline might be because of increased immunity and changing immunity patterns as vaccines come on the market and wear out, versus how much might be some kind of protection that we're getting from season for any number of reasons. And we need to be able to distinguish that to understand the future risk moving into subsequent seasonal cycles. Secondly, in the context of having a vaccine, and we've seen this with other infectious diseases that show a seasonal cycle, depending on the characteristics of the vaccine and the immunity acquired by vaccination, there might be some real opportunity to issue vaccination campaigns in a global strategy that's aligned with seasonality in a way to optimize strategies as we do without even thinking about it with influenza. Okay, so first major point for our community is that understanding seasonality is very important. So next question, why would we even expect there to be seasonality? Okay, and so I think at this point, many in the audience would already be familiar with this, but there are several reasons here, and they're not mutually exclusive, and they also don't point to the same kind of analysis or intervention strategy. First one, as I noted, the virus stability and viability can be directly affected by the weather, which is a seasonal cycle in many places. Second point is our own susceptibility immune response is sensitive. And then you've got human behavior. And first point I'm making about human behavior is related to the weather, right? Being inside or outside, more crowding happening perhaps indoors during cold seasons. And then there are all these societal patterns that might not be meteorological related, but like school seasons or holiday seasons, things that change massive behavior scales that are not related to weather, but are seasonal. And so to make that point here, if you're thinking about the virus or our response, you care about weather and indoor environment. If you care about behavior, like how much are you inside or outside, that's mostly outdoor weather. If you care about something like the holiday season, that has nothing to do with weather, or very little to do with weather. That is essentially just a calendar-driven event, all of which might show some seasonal expression. Okay, so seasonality is not synonymous with meteorological sensitivity. And I'm making that second point because there's been so many studies of meteorological sensitivity. I know that I'm running out of time here, so I'm not going to get into all the details of all of these studies, but there's just one review that we worked on. There have been many good reviews showing how the different colors and shades indicate different results about meteorological sensitivities with respect to temperature or humidity in studies of COVID-19. This is really important research. I personally spent a lot of time trying to understand these differences, but it's not quite the same as seasonality, okay? Then you've got your pure seasonality studies. Here's a result that I'm showing. I think it's a nice preprint. I'm not endorsing this result. It's not yet been through peer review, but it seems like a nice analysis where they simply used a seasonal curve to isolate cases of seasonality. And that's very different, right? Because in that case, the opening of schools is in the seasonal signal. That's different from meteorology. So why do I highlight these two differences? Because for the Earth observation community, we play a really important role in distinguishing between these, okay? You can do a lot of statistics on timing, on time series analysis to capture seasonality. if you understand what's driving that seasonality of the various hypothesized drivers, this is where your Earth observations, your distributed and in time and space analyses of your meteorological variables, of the human systems associated with them, as we're using Earth observations to look at things like population, look at movement, can really be critical. So there's a real opportunity and need there. Okay, so moving forward, role of observation. I'll close here with a few suggestions. We need to continue to work proactively to harmonize Earth observation data with relevant Earth health data and covariates. And that's easier said than done, as anyone who's tried to do it knows. A little plug for our own work here. I think these slides will be made available with these links to work that my research associate Hamada Badr has done to create such a unified data set. And it takes a long time, trust me, it's a big pain. And so I'd love it if other people could use this. It's a publicly available data set that attempts to make this alignment work. Next point, we need to take personal responsibility for integrating environmental and non-environmental data. There are many really well-meaning, very smart people in other fields who are grabbing Earth observation data to put into their analyses. And there are many of people in our own field who are working on correlations between Earth observations and health data, but without proper consideration of all confounders. And that's just really challenging, and it requires collaborative multidisciplinary integration. And it's not enough when the issue is this high profile, it's not enough to just publish your own angle on it and wait for peer review in the community to let everyone know if this angle is important or not. You really need to do that before it goes out because people are going to respond quickly. And as we've seen, to studies that appear to show an important angle, which might be taken out of context. And we focused on this in a study, if you're more interested in this, that we did through the WMO task team on COVID-19, focusing on best practices and how to do such analyses. And finally, we say this all the time in science, but communicating findings clearly and cautiously is essential here because decisions should be made on best information informed by Earth observations. But people are also eager still, even a year and a half into this, are hungry for information to act upon. And if you provide information out of context, they can be misused. And we had a piece that came out of last year's global symposium on climate drivers of COVID-19 that resulted in a short paper describing some of the perhaps more burdensome but more essential processes that we should all go through when trying to publish and publicize our results on COVID-19 to ensure that we are up to the highest standards of actionable information. All right. Thank you so much for your attention.
Thank you so much, Ben. Now we're going to move on to the second panelist, Dr. Andreas Galoudis, who is the chairman and founding member of the Institute of Sustainable Technologies for Energy and Environmental Protection. Until 2020, he served as principal scientific officer of the European Commission on Environment and Industrial Hazards, where he coordinated both the European auto oil programs that formulated the regulatory directives on clean air in all member states. And again, here's his quote. Regulatory interventions for environment and health have reached, since 2010, the era of diminishing returns for implementing regional or global solutions. We have observed that the current pandemic has opened a new era for temporarily viable solutions with satellite observations combined with unexplored instruments, allowing the deployment of unique and innovative techniques. All right, well, the floor is yours, Andreas, while I am sharing your slides.
Thank you very much, Helena. I'm sorry for not being able to share my screen, but I hope we can go ahead. The first slide is mainly some information about the healthcare facility sub-working group that has been set up in this forum for GEO. And what I would like to say is that normally we had earthquakes, floods, or atmospheric events which are naturally extremes, and they were actually very frequent in the past, and most likely it's going to be more frequent in the future. We also had needs for the coping with the heavy demands of healthcare facilities on man-made cause toxic releases or radioactive accidents, which might be rare, but they are affecting large population groups. All these are time-depending events with health emergencies for which the healthcare facilities sometimes were coping, sometimes not. Obviously, this pandemic has actually caused an escalating demand of hospitalizations that can raise acute needs beyond the normal capabilities. And what I would like to show with this short presentation is mainly what has happened primarily because of the healthcare facilities under pressure. Next slide, please. What you see here is primarily the classical images from China when it came to Europe. It was a big surprise that northern Italy has been affected by a significant number of death cases, which you see on the death total on the top for the year 2020, continue until the year 2021. What you see here with the orange color is primarily the excess deaths, the deaths that they are in excess of what has been expected or projected for that year. And the area where you can see at the bottom of the screen is mainly where I have got this type of data. It is interesting to see that the excessive mortality in northern Lombardy has actually been caused by the non-capacity of the healthcare facilities to handle, in addition to the lack of treatment for the patients that they were admitted in intensive care units. Obviously, the situation is quite different, and I think Ben has actually spoke about some sort of seasonality. We see the seasonality also on the death and on the excess rates from the expected death cases. On the right-hand side, I have actually put the numbers for United States, and obviously all these numbers are falling for this period quite nicely. Next slide, please. Obviously, the geolocation of excessive mortality is very important. And what you see here is deaths in thousands, in excessive deaths of mortality fluctuations for the various countries. And what is interesting that irrespective of the numbers, the total numbers that you see here, that they are huge, United States and Italy, as well as England, they are all and Spain, they're all on the top of this scale. However, if you go on the rates per 1,000, death rates per 1,000, excessive death rates per 1,000, which is the next graph, perhaps it cannot be shown. Yeah, okay, thank you. The situation is quite different here, and obviously the differences on the rates here is because various countries, they have various infrastructure with healthcare facilities and various types of geolocating these type of facilities and various operation modes where you see that the high numbers that we have noticed for United States and Italy, they are actually coming in the middle of the scale. Obviously, this is mainly some information related to this, but the next slide shows primarily what we wanted to do with the monitoring by Earth observations of healthcare infrastructures, healthcare facilities, mainly for their infrastructure, their status, and how they cope with additional facilities. In the healthcare, in the goals for this area are summarized with the 5 bullet points here. First was actually to set up a partnership with international organizations as well as various types of countries, and that they are having an interest in sharing the status of their facilities and their risk to environmental stressors. Obviously, we had to integrate Earth observation data sets, and I will show you some of these in the following slides. We had also to access their well, it's fine. Primarily, no, it's fine. It's fine. Let's go to the next slide, Helena, please. Next slide. What primarily you can see the variations of what are the images of the healthcare facilities. On the top of the image is a healthcare facility on northern Central Europe in the region of Lombardy. And on the right-hand side is a healthcare facility, and the image, as you see that by Google Earth, on southern Crete. The interesting thing is we were hoping that between 20 and 22, we had to start the geolocation process of these facilities on the basis of where these facilities are in Europe and United States. And for these healthcare facilities, we were taking consideration hospital, medical centers, health centers, home health services, nursing homes, or even pharmacies. Next slide, please. Well, obviously, it's interesting to see if you look into the right-hand side of the image. If you look to the images if you look to the healthcare facilities in Italy, we are talking about nearly 4,000 facilities, 737 of which are situated in the various counties of the region of Lombardy. You can understand that these healthcare facilities, they have been actually carefully monitored in terms of admission during the COVID pandemic, but we have noticed that it was essential to increase the number of these healthcare facilities. And the numbers that you see red is mainly areas where we had increase of demand and the need to build up quickly mobile healthcare facilities. Obviously, we are talking about big data, and this type of big data is really interesting. We are not even discussing for the time being the adequacy of the status of the infrastructure from administrative purposes, but it is really interesting to see how this pandemic has given us capability to see in real time the functioning of these facilities. In the future, we would like to impose population densities and assessment of adaptation health needs with intelligent on-site technologies and sensor infrastructure. Next slide, please. Well, now, if you can imagine that you need to do this process of extracting the images for the healthcare facilities, I'm repeating, what you normally get is the red dot in the middle, practically is the geographical coordinates of the center of these healthcare facilities. But what you had to do is to actually look into the infrastructure. This infrastructure, of course, now we have the intelligent applications that they are taking the footprint of residential structures, but not of the structures within the red shapes that they are actually determining the healthcare facilities. So that means that for all Europe or for many applications, we have to do deep learning models from imaging, IGMA segmentation, and obviously we are not talking about trivial. This graphic CPU times and the CPU times capacities are really tremendous in order to carry out this process, even for a single country. Next slide, please. Well, the second part of my presentation is mainly before I start the second part of my presentation is I would like to be particularly thankful for Helen Amos, Binita Casey, and obviously Helena, and Munana Singh Lanka, and John Balbus, primarily because they have actually been supporting in this work group and actually have thematically helped in setting up a small pilot study that has been just completed in Rensselaer Polytechnic Institute with the students that they were able to integrate healthcare facilities for United States, several states, together with environmental data. The next two slides in mainly how important it is. This is a story of success that has been actually mentioned by John Balbus when we setting up this project. The tropical storm Allison in 2001 has been the most costly storm in United States, and the healthcare facilities that you see there in Texas has been devastated for a certain period of time. However, when we had after the mitigation measures they were taken into consideration in 2017, Similar type of storm or similar amounts of rain has actually resulted in the hospital facility to continue to operate on a regular basis. And obviously, this is an important step forward. Next slide. And obviously, what I'm very glad to say here is that Casey Benita from NASA has given us this projected risks from future floods for healthcare facilities. And what you see with the colors on the right is a map of the United States on how these facilities and what sort of risk is to be expected in the year 2040. Obviously, this is a simulation, but if it is coupled with the images, operational images, as I've shown you before, it is a very interesting tool to have in consideration, both for regulatory projections, but as well for real-time assessment. Next slide, I'm approaching the end of my presentation. This is my final remarks, some of the final remarks. Please take into consideration this is a starting work and the initial efforts for developing an operational collaboration for healthcare resilience. As I mentioned, it is not an easy job. It requires a third generation of handling data sources, even from static geolocated healthcare facilities. It is actually requires a complicated monitoring process, but when this process is put in place, we will be in a position to optimize the relief capabilities during emergencies. We will be able to target vulnerable population groups like children or elderly that needs to be affected by specific measures during the emergencies. And obviously, we need to proliferate from the immense opportunities this COVID pandemic has brought us for advancing a big and reliable data handling for the benefit of rich and poor countries. This is my last slide, and with this I would like to thank you very much for no, this is an additional slide. This is the thank you slide only. Thank you very much for your attention, and I will be very happy to provide you more information. More importantly, I will be very happy if you will be willing to join this work group and participate in the various steps, either for the handling or for the extracting the information or for the handling of the breach with environmental data. Thank you again.
Right, thank you so much, Andreas, for again jumpstarting this session with another topic that we are discussing in the EO for Health. So now to our final panelist, Dr. Gina Shirauchi. She is the principal engineer at HR Wallingford in the United Kingdom. She's currently working on 2 projects funded by the UK Space Agency that aim to use satellite technology to help countries meet their sustainable development goals. She leads DEMOS, a project that is developing a dengue fever forecasting system for Vietnam and the East Asia region. And her quote, "It is very rewarding to have the chance to make a difference in countries that may be suffering from extreme weather, such as droughts and floods. It's amazing to know that your work actually makes people's lives better." So thank you, Gina, for that inspiring quote, and the floor is yours.
Thank you, Helena. Hopefully you can all see my screen now. So
perfect.
Hi, everyone. Yeah, and thank you for giving me the opportunity to talk about DEMOS, which is a dengue fever early warning system that we have developed as part of this project that's funded by the UK Space Agency. So first, a bit of background to why we are focusing on dengue. So dengue fever is today the fastest spreading mosquito-borne disease in the world. And due to the surge in dengue epidemics around the world in recent decades, the WHO included dengue in its list of the world's top 10 public health threats in 2019. The costs of dengue fever are believed to be higher than those of other infectious diseases. And in particular, countries in Southeast Asia have suffered some major outbreaks of dengue fever in recent years. So our main objective here was to generate a system that gives health officials several months advance warning of a likely outbreak of dengue fever. Now, because mosquito survival and biting behavior is affected by environmental conditions, we can use satellite data and weather forecasts to predict changes in dengue risk. The first demo system that we developed was for Vietnam, and that happened back in July 2019. And since then, we've had two additional systems developed, one for Malaysia and one for Sri Lanka. This image here gives quite a high level overview of how the demo system works. So we have Earth observation data sets such as rainfall, temperature, humidity, coming together with weather forecasts and water availability forecasts, which are then fed into statistical models of disease incidence. And these models can then predict the likelihood of future dengue epidemics up to 6 months in advance. A key concept behind DEMOS is that the ecology, dengue ecology, is regulated by the climate. So temperature and humidity, for example, influence many aspects of the biology of mosquitoes, such as their development, their survival, the biting rate. There are other environmental factors such as land use change and urbanization who also have an effect in the presence of mosquitoes. And in countries like Vietnam, where the ground-based monitoring network of these environmental variables is limited, the use of Earth observation data can provide a consistent representation of the variation, the spatial variation of those key variables, and also of key socioeconomic parameters, such as population, for example. And also an added benefit is that today many high quality Earth observation products are freely available, so we can use them. One other innovation behind DEMOS is that it includes a water availability component. We know in general that surface water can influence mosquito habitats, but it hasn't been very frequently accounted for in dengue prediction models. And as you can see here, the water availability forecasts are fed into the statistical forecasting models of dengue, which also integrate a range of other covariates important for dengue transmission, as we mentioned, the number of dengue cases, land cover, rainfall, temperature, and population density. As I mentioned earlier, the system has been operational in Vietnam since June 2019. And the project team is currently engaging with the Ministry of Health in Vietnam to make sure that all the components of the system are fit for purpose. Here you can see a screenshot of the website that is designed to communicate the dengue forecasts to the Ministry of Health and users. And it's currently being used at central government level in Hanoi, with other users accessing it at regional centers around the country. The forecasts of the dengue outbreaks that the system produces can help the Vietnamese government to put these early actions in place at community, district, and national level, depending on the forecast lead time, as this figure shows. So, for example, at the national level, the Ministry of Health can plan to allocate the resources in the provinces that have the highest risk for an outbreak if they receive a warning up to 6 months in advance. At the same time, at district level, the local authorities can alert the communities that there may be an outbreak over the next couple of weeks. And then they also start spraying to eliminate mosquito breeding sites. Now, since the system became operational back in 2019, we have been trying to understand the skill of the forecasts. And we've used a variety of approaches, but in general, the skill has been assessed by comparing historical forecasts that the system has produced to the number of cases, of dengue cases, which were subsequently observed. So any given forecast of DEMOS provides the probability of the number of cases of dengue exceeding a particular threshold that is set by the Ministry of Health. And here this this graph here examines whether this number of cases that were subsequently observed exceeded these thresholds or not. And then it provides a visual method of examining the forecast skill. So on the y-axis of this graph, we have the Vietnamese provinces. And these are just the southern provinces of Vietnam, just because I couldn't fit all 63 provinces in one slide. And the x-axis shows the first month of each forecast that has been issued since July 2019. The dark colors indicate a higher forecasted probability of number of cases exceeding a threshold, which is effectively a forecast for an outbreak. And where we have the X, the letter X, that indicates that the number of cases that were subsequently observed on the ground exceeded that threshold. So indeed, there was an outbreak observed. So that means that where we have an X in a cell where the shading is darker, that means that an outbreak occurred where the outbreak was forecasted. So this is a good result. Where we have an X in a cell where the shading is lighter, it indicates that an outbreak happened, but the system did not forecast an outbreak. So this is bad, and so on. So it can be seen that most of the X letters lie in cells with darker shading. And also most cells with light shading have no X. So this in general indicates that most of the time the system is successfully forecasting outbreaks and successfully forecasting periods where there are no outbreaks. And this is for 1 month in advance. So overall, we can say that the forecasts for provinces in the south of Vietnam in this particular graph have been very good, very accurate for 1 month in advance. Now, if we look at the same graph, but for forecasts with a 4-month lead time, we can still see that for most of the time, the system is pretty good at forecasting outbreaks or periods where there are no outbreaks 4 months in advance. But of course, the skill is not as good as with the 1-month lead time. We have also been trying to document the extent to which DEMOS is helping prevent dengue outbreaks on the ground. And I have included here some of the feedback that we are receiving from end users in Vietnam, with examples of how the results from the early warning system are being used. It's still early days, but we are really pleased to see that the system has started to change Vietnam's reactive approach to dengue to a more proactive one, and that it is now also supporting budget planning processes for prevention and control. In 2019, we were also awarded a small extension to our grant to try and maximize impact. So we are now implementing the system to other countries in Southeast Asia. We've got already systems in Malaysia and Sri Lanka, which are being currently piloted by the end users. And we very much hope that by implementing these additional DEMOS instances, we can create economies of scale, which will then drive increased sustainability in the region. In Vietnam, we are also undertaking some research to see if it is feasible to provide these forecasts, not only at a province level, as we currently do, but also at a district level, which is the next administrative level below a province. The DEMOS system, the architecture of the system has been specifically designed to be modular. What that means is that it can be easily adapted to include new dengue forecasting models, new data sources, new seasonal climate forecasts. And this image here shows how the various components that make up DEMOS slot into each other. So we have some off-the-shelf components and also some which need to be customized for each new country. But really, the two key requirements for developing a new DEMOS system are availability of historical dengue case data, ideally covering more than a decade, and strong engagement with policymakers from the country that is interested, who are really in a position to work in partnership with the development team. Now to talk a bit about some of the challenges we're facing as this project is coming to an end. So sustainability is a risk for all development projects, and that risk is even greater for projects that relate to new technologies because they are complex, they come at cost, and a lot of the stakeholders are not yet aware of the potential for these technologies to solve their challenge. So to mitigate this problem, we've had to work very closely with end users to involve them early in the design and the development process. The long-term goal here is that this technology becomes a business as usual element of the health sector in Vietnam, and that the need from the DEMOS team to support it diminishes. So over the years, we've learned that in order to make a system like that sustainable, you have to address the problem in a way which is relevant to the local community. So it's very important to co-design your methods and tools with end users early on and to build this ownership. The multidisciplinary nature of the team is what produces the highest value and what brings the innovative ideas on the table, but it also brings some challenges. And with systems like DEMOS that drive, these new types of collaborations between stakeholders who may not be familiar with each other, such as space agencies, weather forecasters, government ministries, development organizations, these are all very distinct communities. And for example, the scientific communities may not know much about the policymaking process. And many people who are involved in policymaking don't really know much about forecasting uncertainty and space technology. So we've all had a key role to play in bridging those gaps here. And I think that's the end of my presentation, with credits to our large project team and the UK Space Agency for funding the project. Thank you.
Thank you, Gina, and all of the speakers. If you have not put your, for the speakers, if you've not put your video back on, please do that. And I am thrilled to have just a few minutes to do a few follow-up questions. So I'm going to kickstart and ask a question of each of you. And then we have a question here in the chat from a colleague in the Americas. So my question, Gina, you've almost gotten there. You just described very ably the partnerships, but the theme of this GEO group is DEMOS really being rationalized, and that's what we're trying to do in a lot of our other project areas. So for Andreas and Ben as well, what do you see as the critical pathways to establishing and sustaining those partnerships? So Gina, your last slide talked about sustainability. It's one thing to develop it in an academic setting or a private sector setting, but how do you actually build the partnerships, and what does that take? And I guess it's a question for each of you, although the partnerships are going to be different. But Gina, if you could, since you were just speaking, maybe just finalize that. And we've had a question also on that point in the Americas. How can we facilitate lessons learned? So I will jump in and say the community practice is exactly about that. So if you are interested in talking about this further in any region, any one of these projects, please join our community of practice calls. We'll connect you with the small groups and we can take it from there. But Gina, back to you on the question of partnerships and what do you think is most critical? And then Andreas and then Ben.
Yeah, so in our experience, I think the most critical thing has been to be able to engage with the end users, in this case, the Ministry of Health in the Southeast Asian countries, early on in the process, from when we started designing the proposal, they were part of that proposal. And that has been critical. The other thing is we had to invest heavily on capacity building, because the whole concept of disease forecasting is new in Vietnam, and they have to, in a way, redesign their whole approach to dengue based on receiving a forecast. So there's a lot of collaboration and trying to learn from each other. And another thing that has helped us a lot in Vietnam has been the fact that we had UNDP and WHO involved in the project from day one. So they really bought into the idea of this system. And of course, they could then open doors to all the ministries in this country because they had, a memoranda of agreement with the right people. If it was just some university from the UK or a consultancy just knocking doors on the Ministry of Health in Vietnam, I don't think we would have gone, much further. So there are a few things that have helped in this case.
Yeah. Excellent. Thank you, Gina. This is good for us to know. Andreas, the question about partnerships and the most critical pieces thus far, and also, I guess, the gaps. And while we're at it, I don't know if you noticed that Stephen Ramaj from our GEO Secretariat, who's incredibly helpful to our group, has also asked a question about whether you're working with UNDRR, formerly UN CIDR. I forgot what that stands for now. I used to know.
Right. Thank you. Thank you, Judy, for this introduction. I think it's interesting that obviously the work on healthcare infrastructure is quite important for regulators, but as well as for relief agencies. I see that the very good example of resilience that we have had in United States and Texas is a good document that needs to be implemented. Around $5 billion that they were spent in the 2001 could be wisely spent in order to minimize facilities. So I see the project for healthcare infrastructure is not mainly for observing or spying on what is happening on the ground. It's mainly for providing solutions primarily to poor or medium GDP countries in order to reach or to affront emergencies that otherwise would have not had the means to provide. We look forward to have such type of we certainly look forward to have members from such partnerships, but obviously for the time being, it is understood that the project is requiring quite a lot of research capacity in order to affront the situation as we would have liked to do. So I think as long as we have pilot cases, certainly we will be very successful pilot cases as the one in the United States. We are going to be very useful in the future, I think. As for NISDR, I think that for the time being we are not working, but certainly we would have liked to work immediately on this in order to share the experience from the pilot study that we have just completed. Thank you.
Thank you, Andreas, and thank you for your leadership on that whole topic throughout COVID, before and after. So much appreciated.
Thank you.
Ben, now to you. I know the partnership issue takes a whole different angle when you are really trying to figure out what the heck's going on, but could you say a few words about what kind of partnerships you think are most critical and what may most still be needed?
Yeah, so first of all, just to endorse the former remarks, and I think Gina really said it very nicely when it comes to establishing an initiative on any given health challenge. I think a couple of things that we've learned from COVID that are generalizable. First off, it's really important to understand the mapping of decision-making within a government or any other institution. And so in the case of COVID, we had a lot of kind of environmentally based analysis being thrown over the threshold, right, via the media or via publications and preprints. And that we can discuss the strengths and negatives of that approach. But really, it's being able to integrate with the experts who were informing the government officials is very important, because those are trusted and scientifically informed voices that you can speak through rather than coming out from a different angle. Now, COVID's a little bit unique, right, in the scale of the media attention and such, but I think that that was important for us to learn. And related to that is the importance of these lasting relationships. Very often we approach end users, speaking for myself, I'll approach an end user because I'm like, hey, we've got an idea on X health crisis, right? Let's work together now and ideally co-develop ideas, right? As Gina was saying, you work with them to build the questions. But in the case of COVID, there wasn't time for that, right? And so the places where if we've been effective at all, it's been in places where we already had relationships. We're able to talk to the people who are developing other kinds of non-environmental models, talk to the people who are in the communities, in the case of our work in South America. And those existing relationships made it possible when the next crisis came. And so I think that in that sense, COVID-19 has been a real opportunity to strengthen, to deepen these relationships, and we really need to keep those relationships going because this is not the last crisis we're going to face.
Yeah, wise words, Ben. I have a few comments on that actually, and about our community practice too. But I think, you know, we were trying to help GEO catch up a little bit, so we're a little bit over, but don't want to be too over. Trying to help them make up some time. So I think I apologize for cutting the discussion section short. You guys did amazing presentations. I am just, every time I hear our community practice talk, I am so just honored to be a part of the leadership of it, because it's all about you guys and the amazing work you're doing. So let me just turn it over to John to say a few closing remarks, and then Helena, and then I'll take it back and officially close out the session. So John.
Oh, well, just to echo what you said, Julie, thank you so much to all of our panelists. They're really, as Julie said, amazing talks on such important issues to the health and air quality community, but to the globe. And that is the point of GEO, is bringing us all together to help address those issues. So again, thank you to all of our panelists. And thank you, Julie, for running our wonderful discussion session, and Helena for running everything to put this all together for us in this parallel session and getting us all organized. And Helena, I'll turn to you just to let people know about the next telecon.
Hi, everyone. Again, thank you to everyone who is on this call today. I put the link for our next telecon, which will be on Tuesday, June 29th from 8:30 to 10 a.m. Eastern time, GMT-4. We welcome everyone. It's open to the public. One of the things to really add to this dialogue about sustainable partnerships is really the expertise among our three panelists. We have a community of practice really where we leverage the expertise among an array of disciplines. And just to highlight the panelists, our stellar panelists on this session, we have PhDs in geology, geophysics, hydrology, fluid dynamics, and master's degrees in engineering and social sciences. But they're all tremendous leaders trying to use Earth observations in an attempt to develop some innovative solutions for public health practice. And that's really something that your expertise really can be leveraged in our discussions, because everyone has a different perspective coming to the table. So again, we invite everyone to join our community practice meetings moving forward. And thank you so much for our panelists for your time to share your expertise with us. Julie, the floor is yours.
All right, again, a thank you to everybody, the panelists, but also the participants. And just please do a couple of things. If you are all interested in this area, come join us. If you're interested in learning about some of these other things, or how to maybe make them a little bit more applicable in your country or in your region, that is what we are intending to do. That's what we do through our small groups. And the other part is that there are lots of other parts of GEO that touch on health. So if you're involved in those other groups, help us make sure we are appropriately connected. You know, health is a part of a lot of other things too. And so the Secretariat's great about helping make sure we're connected. But also, if you are in those other groups, please help us stay connected and connect appropriately. So I think without further ado, we're a few minutes over, start a little late, but thank you all so much for being here and for being present. We hope to see you, if you're not already in our community practice, we hope to see you on the next call. And if you have any questions, as John said, please email John or Helena or me. And actually, I don't know, I was going to put that slide up, and now I've lost my screen share. So yeah, I think with that, we should probably just say thank you all and close. And have a great rest of your day and a great rest of the symposium all. Thank you.